So the Inspired program is for our patients with COPD, and what it does is it moves across the transitions of care points in our healthcare system. So it involves acute care as well as primary care, chronic disease, and also in home care in some of our instances.
So the Inspire program will provide the same interventions that the COPD program does, but at a more intensive rate. So we're going to see them a little bit sooner, connect with them sooner, and offer them more resources.
So once they're referred to the Inspired program, we help connect them. Well, I tell them in hospital what they can expect from the Inspired program. I let them know that after discharge they can probably expect to hear a call within the next 48 hours to see how they're feeling upon discharge, that they're comfortable, that they filled their prescriptions, and that they're feeling better than when they went into the hospital.
I also will be connecting the patient with the COPD Educator, which is a registered nurse in the community. It will either be through primary care or home care, depending on that patient's needs. And the call does help me determine which of the two paths is most appropriate at that time as well.
So we receive a referral in my district, and so we are home care nurses that go out into the community to see these patients. As a home care nurse, we get to develop a relationship with the client in their home environment, which is really nice because we get to see kind of how they live, what they're living in, what the conditions are.
But now they know they know how to take their inhalers. They know the importance of physical activity, and now they can walk into the building and they're not really short of breath. And they know what they need to do if they have a flare-up of their breathing. They know how to take their inhalers. Many times when patients have been prescribed inhalers, they're not necessarily aware of how to use them. Like, we'll review how to use them. We also will inquire about immunizations and recommend certain immunizations if they need them.
We feel much safer knowing that we have the CFHI and Inspire backing us up. We can call for help if we need anything. We know to call for help if we need anything.
The Inspired program, along with the other initiatives that Health PEI has put in place for COPD patients, has added to my toolbox. It has enabled me to be proactive rather than reactive.
Continued involvement in CFHI through the Momentum Challenge. We see that as helping us to sustain our gains and continue to build on our successes as we learn from other provinces across the country and some of the things that are working well with them.